Hello everyone, thank you for watching. My name is David and I'm a life coach. I help people normally with emotionally abusive, traumatic relationships, helping people recover and heal and grow from these things. I want to make this video tonight in light of the coronavirus, the epidemic or pandemic. I'm not claiming I have a bunch of new information or anything. I made this video because so many people are at home now. And I thought maybe it'd be great to give you guys some more videos to watch. I've had people ask me to do that. So I plan on making more videos this week, next week, maybe more continuing on. If you guys have any topics about the coronavirus you want me to talk about, I will. I'm thinking about making videos about maybe things you guys can do at home while you're stuck at home, preventative measures, just kind of discussing a little bit of what this is about and just things that I've learned. Maybe I can help you guys understand what's going on a little more. I don't know. I hope that I can. So briefly to just talk about the virus itself, I'm going to list the numbers where they're at right now. This is March 18th. It's about 9 p.m. Pacific time, and there's about 220,000 cases right now, 9,000 deaths so far, and there's been about 86,000 people that have recovered so far. So, and I want to say something for all of you out there. Be very careful about the source of information, where you're getting your information. I've heard some of the most craziest, outrageous things that simply aren't true. So the for sure source is cdc.gov, Center of Disease Control.gov, cdc.gov. That is the actual best source of information about this. So the numbers I just read, I hope, show that it's not the virus itself that is the total threat for most of us. The virus itself is a threat for a small portion of us, extremely small portion of us. It's still a threat for those people. I'm not excluding them, but it's about how we are reacting is the biggest threat. Okay, what is going on right now is what people are hoping for. And what's going on is about it. This is all about the explosion, overwhelming capacity, the amount of people getting sick and how many people can get the help. So even though this is a virus that most people are healing from totally, there are always going to be some people that react badly. Whether they're already have prior illness, or they're maybe old age or young, stuff like this, that make them more susceptible to having a worse reaction to this and not fighting it off and possibly even dying. So even though it's a very small portion of people, the problem is being overwhelmed with healthcare in the hospitals and stuff like that, and people getting the exact help they need. We don't want it all at once. So what is going on right now, what countries are doing, is trying to make that peak stretch out over time. So not everyone goes to get help at once. So it could be the same number of people getting sick, but it's over time so that more people can get help. With it being over the capacity for help, that's where the deaths are coming in, okay? That's why. It's not even necessarily just the virus itself. It's not being able to get the health care that they need, the help they need. So, real quick, I'm almost done. Symptoms: cough, runny nose, sore throat, fever, difficulty breathing. I think people who have had the virus, I have some people in my life, personal life, that had it and they're already better, and some getting better. I think it's important to just monitor how you feel and really take care of how you feel, okay? Really take care of yourself, seriously. This isn't to be so lightly, like, hey, it's just a cold, you're going to be fine, or just the second you start feeling better. It doesn't mean go out and play and go about your normal day. Take care of yourself, because this is causing shortness of breath later, pneumonia, things like this, and those are things to watch for. After you've caught the virus and you think you're getting better, please watch for shortness of breath. You could have pneumonia. That might be something you need to get help for. And if you need to get help, go in and get help. But I would like to advise people that feel like they don't need it and they're okay, a little cold and maybe you're getting better, and maybe you don't need to take up the help, the small help that's available, okay? So I just wanted to talk a little bit about that, about the virus. What this video is particularly about is about hoarding. This is insane. Our reaction is just insane, man. This is so crazy. I went to the grocery store today because I just needed things. I don't have anything. Literally, I didn't have any food. So I went to the grocery store today. 2 grocery stores out of everything. Out of everything. I mean, there's a few things left on the shelf you can't even make a meal out of. I got angry, you know, and because I'm watching people just full as much as they can possibly buy, and it's just a real middle finger to the rest of humanity, the rest of society, the rest of your community you live in. And it's not okay. It's not. And I hope maybe I'm shaming some people who have hoarded, you know, because you got to stop. We all need some. There is no reason why this virus is making people eat more food, right? So why are we hoarding? Because we're so scared, so scared. Hoarding is narcissistic, isn't it? It's so narcissistic. Hoarding is obsessing and compulsively purchasing items that may be useful or valuable in the future. Why do you need it in the future? What does this virus, some people getting sick, mean that you need all this stuff? Oh, because other people are hoarding. That doesn't make it any better. It doesn't make it okay. It's horrible. Really. It's horrible that I couldn't eat. I couldn't go get food. Yeah. Really bad. And it is. It's very narcissistic. It is. Let me read down some narcissistic traits. Lacking empathy. Yeah, middle finger to everybody else. I don't care if you eat or not, if you don't get the things that you need. It's not even just food. Self-importance. Oh, I guess you deserve it more than everybody else. Entitlement. Why not? You want it. You need it. You're special. I'm not kidding. I'm laying into people like this. This is not okay to hoard things and keep way more than you could possibly use anytime soon so that everybody else doesn't have what they need. That's so wrong. You're reacting and you're feeding into it and making it worse. Selfishness, suspicious of others' actions and motivations. You're scared we're all going to take it and you're not going to get any. Constant need for attention. Arrogant, judgmental attitude. Insisting only a few understand and preoccupied. I mean, this is just, it's totally narcissistic. Totally gross. And I hope this kind of shows what people do in panic, right? In panic. I'm telling you right now, these physical needs aren't what's important. There's plenty of food to go around. There's plenty of toilet paper for everybody, even though that's not really much of a primary need. Unbelievable that unbelievable. People who have their emotional needs met, who are emotionally healthy, don't freak out about physical needs. Try and add a little more security to your family and your relationships you're in right now. Offer some more security. Spend time with them. I mean, you're already forced to go home away from your jobs. You don't need to go to bars and social situations. Stay home with your family. Make them feel secure. Take care of the people that are ill. Don't go out and get sick or bring germs home for other people at your house. Give people in your home right now, in your life, emotional attention. Check on people. If you don't live with them, check on them. It feels better. It helps people feel better. Feeling better makes you less likely to get sick. Feeling worse and people not checking on you and people don't care make you feel worse, depressed, stressed, and it makes you more liable to get sick. Autonomy. Autonomy. It's not just you. It's not just other people that need things. It's all of us, each one of us, okay? Connect with your loved ones, emotionally connect with them, talk to them, ask them how they feel, listen to how they feel, tell them how you feel. Now's the time for intimacy, privacy. These things will help you feel better. The fact that the government's making us, enforcing and trying to force us to stay home more will actually help you feel better. Should feel better during this time. I understand it might be stressful, you might have some fighting, but try to get along as hard as you can. Really right now is the time to figure out what is important to you. What do you really value? And I think this starts to force people to show it, doesn't it? So what's really important to some people? Food and material things. That's really important. Physical needs, right? Screw everybody else. It's not that important to me. I'm not freaking out. I went to the gas station and got something to eat and went home. Oh well. You know? But I checked on my loved ones. They checked on me. I feel good. Lots of attention. Gave them attention. We feel better during these times. Even my friends who are sick, they're okay. They aren't freaking out. None of us are freaking out. It's just embarrassing as a human being to go see this, to see people's reaction like this. I mean, think if it was really big, you know? I remember 9/11 for a moment was a time where community came together. Not now. No one even can touch each other or get near each other or give each other a hug, but you can with your family. Anyways, I just wanted to talk a little bit about the virus and just make another video for you guys sitting at home, you know. I know almost everybody except maybe healthcare takers, thank God for you guys, are sitting at home right now, and you might be stressed out, no work, maybe not enough money, you're worried about not enough food, not enough toilet paper. So I thought I'd just make another video to just, I don't know, give you guys something to do, something to watch. Hope it makes you feel better. I hope something I said calms your nerves, relaxes you, so you aren't so stressed and aren't as susceptible to getting sick. Check on your loved ones. Emotional needs is what's really important right now. There's enough physical things for everybody. This is insane. There still is going to be. Hoard all you want. They're just going to bring more stuff. I don't understand what this makes anybody feel like you need tons more food now for months, years. I don't know. I've heard some pretty bad hoarding stories right now. Obsessive compulsive. Think what's valuable to you right now and show that. Seriously. Stop freaking out about all this stuff and freaking out about not enough physical stuff. If you have emotional needs met, you won't freak out so much. So take this opportunity to be a little closer to your loved ones. Okay? Thanks, guys. Give me ideas if you want me to talk about it. I'm thinking about just making more videos just to calm the nerves. Maybe I'm talking about the psychology of some of this stuff, you know? So feel free to ask me questions. Ask me anything you want. Thanks, guys. Love yourself first, and I will see you soon. Bye.